Rick and here. Please share with us about yourself and what you've done in the industry.
Hey, so, all right, perfect. Sorry, I couldn't tell in the last session if this was on. So, I'm Rick. I'm the guy with the really long last name, so Rick is easier. I am a neurosurgery trained physician. I actually started out with translational and basic science research with cannabinoids back in 2005. So I've actually been involved in this stuff for quite some time. I no longer practice neurosurgery. I've actually decided to focus purely on cannabis medicine in South Florida. I actually wear a number of hats now, so I have my own medical practice. But I'm also now CEO of a vertically integrated hemp and CBD company in Georgia. We're also going for our medical grow license. I'm part of a consulting group, and I sit on a number of boards within the cannabis industry.
Thank you so much. And we have next to him Roger Bryant.
Hi, I'm Roger Bryant. I'm a local, so everybody welcome. I own Evolve Distribution. We're a CBD distribution company. I also do a little work with Cannabis Technology Today, the magazine. I got in this field to start working with seniors and working with illness with seniors so that we could get product and get them up and get them mobile and get them out. And so I'm very, very interested in this panel today is how we can do that, what we can do, and how we can move forward.
Thank you. And we have next to him Jenna Nagel, and she is all the way here with us from Austin, Texas.
Hello, my name is Jenna Nogel. Very close. It's okay. I am the COO of Green Cross Health and Wellness. We started as a retail location in Texas. We were the second one to open. Our whole philosophy on this industry is breaking the stigma through education. So understanding what we have in our products and how to relate that to our consumers is very important to us. We have grown into now retail locations, franchising, distribution. We have a manufacturing lab, and we are launching an extraction lab and planning to grow as soon as Texas lets the regulations out and allows us to put the seeds in the ground. So lots of moving pieces, but that's me.
Thank you so much, Jenna. And we have right next to her, Rob.
Good afternoon. I'm a naturopathic physician, a natural trained gourmet food chef. I spent close to 20 years in nutraceuticals and natural products, things you go to the health food store for. I'm a medical director of multiple dispensaries in Arizona. I wear a lot of hats, obviously. I host a show on cannabis radio called Concierge to Better Living. I have a book out called The Cannabis Conundrum. So I also do a lot of advising through my agency Beyond Brands on developing products, branding, marketing, sales, distribution, you name it. Like I said, a lot of hats, but love, most importantly, education. I've always been an educator, a trainer, something that really connect with all audiences so that we can move this industry forward. I'm happy to be here today.
Thank you so much. And we have a subject that is really important right now as more and more of the country is becoming open to utilizing natural plant-based medicine. Can you mix that with your synthetic pharmaceuticals? That's the main thing here. We don't know enough. There is education out there, but there needs to be more. And I really think this panel will be able to offer that interesting insight to how we can develop much more knowledge about the mixing of CBD and pharmaceuticals. So, Rick, I mean, in your experience, what are you finding from the patients you've seen and other people that you've interacted with within the industry and consumers?
Well, in terms of CBD use with other medications, I mean, it's a mixed bag. I think the area where folks are, where the biggest need, where the biggest void is really education, just across the board with any issue in the cannabis or CBD industry. So, like, I mean, when I evaluate patients, I typically I have to spend almost an hour with them, and that's really to go over, okay, why are you on 5 different blood pressure medications when 4 of them are of the same class? Why are you on 2 different thyroid medications? Why are you on this? Why are you on that? does this doctor not communicate with this doctor, not communicate with this doctor? Polypharmacy is one of the absolute biggest causes of adverse events in the United States. It's one of the biggest drivers for dollar consumption in the healthcare industry. So now when you start adding something else like CBD on top of it, yeah, you have the potential to have a lot of problems. So you have to be very cognizant of that, not only as the person either giving that to them or selling that to them, but also as the person consuming that. So you have to watch out for drug-drug interactions. You have to know stuff like, okay, this person doesn't have a gallbladder, so they really shouldn't be orally consuming, CBD. Have they ever had, pharmacogenomic panel? Do they have liver problems? Are they a heavy drinker? So there's a lot of stuff that unfortunately isn't regularly observed or done in the, and I'm talking about the CBD or cannabis industry as a whole. We talk about it a lot at these conferences, but the fact of the matter is it's very often overlooked in everyday practice.
Thank you. And Roger, for you and your experience in this, the development of the interactions of these, what have you seen happen that's been on the plus side and negative side?
Well, on the plus side, it's interesting because we're out there talking to people and they're all looking for a miracle cure. But the reality is if we can evolve and we can go out and solve things that are dealing with their current issues and get them to deal with their pain and other things. But typically, I have had no issues with interactions at all. I work with a few surgeons, but those are all topical. I have had no problem with it at all. So.
Thank you. And Jenna, I know that you've been in this industry for a while and a lot of interaction with developing products and getting it out there and making sure that they're well-tested, honorable product line. Tell me what it's been like for you to make sure your products are actually, working with patients' systems.
Great question. I think the most important thing is testing. You have to know what is going into your product. The other thing is how it's reacting with whatever your consumer is currently taking. So something that we personally look out for is grapefruit interactions. So if you are currently on a medication that has grapefruit in it, there is an enzyme in grapefruit that will elongate the medication within your blood system. CBD does the same thing. So it will elongate whatever medication you're currently taking. It's important to look out for blood thinners. That's one of the main key points that we have come to realize for myself. That's something that we look out for. I think educating your customer on that is equally as important. We've heard a 2 to 4 hour window. If you take the medication and then 2 to 4 hours later you consume the CBD, it doesn't interact as much or at all, as long as the medication has already processed through your body.
Out of curiosity, not to put you on the point, but how many of you know somebody that uses lisinopril or uses lisinopril yourself? I mean, it is something to be concerned with. So thank you so much, Jenna. And Dr. Rob, you have done a lot in development as well as education. What practices have you done in being able to get that information out to the public about these interactions with CBD and pharmaceuticals?
Well, yeah, flying from 85 degrees to 17 was an action of, to educate and to join you guys today. But the reality is I've been doing CBD education for probably 5 years. We were in Puerto Rico. We opened Puerto Rico, and we had to do that with the media. We had to go get and teach them what is CBD, what is cannabis. It starts at the very basics. Earlier today we did a little talk on the endocannabinoid system, which is how our body reacts. And it's interesting because we see different patients, we see different goals. You said there's an interaction with the liver enzymes and the pathways in the liver. I tell you, my mom was a patient and was on 5 anti-epileptic drugs at once just to stop seizures. And they said, well, I said, what's working? They go, we don't know, but they're stopped. I said, so it was my job to try to wean her off as many of these drugs as I could and used CBD, in concert. It was still guesswork to a lot of degree, but it was an option to get her off a lot of these more damaging, pharmaceuticals for a more natural alternative. So it's something that we have to work on. All sorts. Some of these drugs are exasperated or made stronger. Some of the pain meds seem to work stronger. So it's great because you can use less medication as you introduce a compound like CBD. It's not a drop one and replace it for the other. It sometimes requires that healthcare professional to work in concert to help you, manage the transition to a more natural option. And that's something that I always try to push patients and individuals towards, is a safer, more natural option.
Thank you. Isn't it that they say if a person is taking at least 5 or 6 pharmaceuticals, it's a polypharmacy situation there, and the interactions of them sometimes, like Rick was saying, they counteract one another. What can people do? I would think that they could work with their physicians to lay out everything, what they're taking, so they can concentrate it down to not be so overly abundant in the pharmaceuticals they take. Rick, what have you found? Is it that people don't have their physicians speak to each other?
Yeah, so I mean the healthcare system in the United States, because that's one of the major advantages of having a single payer healthcare system, is the fact that you're going to have a centralized electronic medical chart. The fact of the matter is, physicians are humans too, and unfortunately most physicians, regardless of how old they are, where they got their training, where in their career they are, we can always be very stubborn bastards. So we really don't want to be told a lot of times that hey, you aren't communicating with this guy and this thing is not working, or I've been taking this thing that's actually been doing a hell of a lot better job than what the thing you've been giving me. I think that physicians that are coming up now, the younger generations, are doing a better job of listening to their patients, but it is really incumbent upon every single patient to be every patient is their best advocate, and so you have to demand that this physician send a letter to that physician. And I know a lot of especially my older patients get embarrassed when they pull the big list of meds that they're on. I love it because, number one, it makes my job easier, but number two, I know that they're going to pull that list out for every other physician that they see, and it makes it a lot easier for other physicians to keep track of what they're on. And so the folks that tend to have that really long list, even though it looks annoying, tend to have fewer complications. So it's just a communication thing.
Yeah, communication is really clear. I'm really on your health. And Roger, have you come in contact with people who have maybe overdosed or mixed CBD inappropriately with the pharmaceutical? Maybe had some negative effects there?
To be honest, I really haven't, and I'm as much on the manufacturer and the distribution side of CBD. So a lot of my interaction with the medical community comes from surgeon groups or therapists, and in my meetings with them, everything I've seen, again, and I hate to be the positive one, but everything I've seen has been very positive in respect. But I agree with him that you got to bring your records, you got to tell them what you're doing, you've got to be straight. To get a solution, you've got to be honest.
As we know, CBD is a natural plant-based product that the endocannabinoids mix with it within your body, whereas pharmaceuticals is more synthetic. Dr. Rob, you have seen some patients. I know you're focused on education. Have you yourself seen some patients who have maybe overused the use of their CBD mixed with the pharmaceuticals?
No, I really don't think there's much of a concern of overusing or overdosing CBD. I think THC becomes a little bit more of a concern in the sense of how it reacts with our body. It's more stimulating. It works more on the sympathetic part of the nervous system. So taking too much of that and concentrating can have a detrimental effect, especially neurologically, and because of the concentration of the receptors in that central nervous system. The challenge with CBD isn't so much overdosing or abusing, is it's understanding that it's not necessarily the panacea to all ills, so that it may work as complementary with other ingredients, other herbs, other even medications. Like I said, you can lower certain medications like opioids and balance it with a little bit of CBD. So from a safety profile, it's generally there. It's where the industry kind of advocates you need more and more and more and more in order for it to be effective, and that doesn't always apply. You have some people that react very well to small doses, and that is enough to affect the receptors and see dramatic change. And when you have so many different factors that affect the individual, it really comes down to, again, we talked about in the previous talk, isolate versus full spectrum, other compounds, other factors in your own health and lifestyle. So for the most part, CBD seems to be safe. It's really what else can you do to support that compound. Just as I said, there's people that, we tried, St. John's wort was the answer for depression several years ago. And so they tried to isolate out the one individual compound, the hypericins that they thought were the active compound that treated depression, and it didn't seem to work as well, except when they used the whole plant. And then the real botanicalist, the herbalist, said, okay, St. John works great for that, but it works even better when you add 2 or 3 other herbs that also support the system, so you have this big complement. And that's where it comes to the art of combining and using these natural remedies to optimize your well-being. It's not going to be a one compound fixes all type of solution. And the more we focus on that, the more we go into a pharmaceutical model that really doesn't allow for the plant to do its job the best way.
Thank you. Jenna, with Green Cross Health and Wellness, you help in developing products. What do you think is some of the main end goals of the products that you're developing? What are you looking to achieve from them?
I would say overall general health and wellness. That we do modify products to kind of target specific areas, but generally we want people to be well and live well. I think it's a combination of using full plant versus isolate and different routes of absorption, bioavailability whenever you're developing products, and really understanding, I guess, the best route of administration for the ailment that you're looking to aid in.
Or more than one.
Yes.
When I dealt with a
absolutely.
lot of pain doctors, it was, which one should I give my patients? And I said, well, realistically, pain's origin may be multifactorial. So would you benefit from taking an oral product that absorbs, gets into the bloodstream, starts hitting the receptors, maybe reduces some inflammation? At the same time, you might benefit from a topical product at the site of pain that might address that more acutely, and in combination over time, this is going to address the true origin and reduce the need to where you're not just taking a product as a Band-Aid, you're actually trying to address some underlying causes of your issues.
Yeah, I think you hit it spot on. Something that we focus on is it's not a one product solution, usually ever. You want to take something daily, something to supplement your endocannabinoid system on a consecutive basis. Then you are going to have things like topicals for your localized areas of pain, things like edibles for migraines or smokables for migraines, things of that nature. So it's typically never a one product solution.
In manufacturers, we've always figured out, or we've recently figured out, that if we add ginger, we add other cannabinoids in there, and we start layering those in our CBD, we get better results.
Yes.
We get a much better product. People, are more resilient to having different things. One of the stories I like to share is, I never knew that marigold was a cannabinoid, and then one day I realized all those old ladies doing marigold teas they had a hell of a good time. But anyways, the layering effect and using multiple cannabinoids is key.
You mentioned there something about the whole plant. We know that there's been a lot of science and research on this, but overall, it seems that a lot of people are focused on whole plant, full spectrum, instead of the isolate part, the isolates of the plant. What are your opinions on that? Do you find the effectiveness of whole plant, full spectrum is more beneficial than the breakdown of the plant itself?
Either.
I've had to stop pretty much on a lot of my isolate because I work a lot with the health community and a lot of the health food stores, and I can't put isolate in their stores right now. They're all full spectrum, natural, organic. So I don't know if that'll swing back, but what I'm seeing in a retail market, what I'm seeing right there out there, I'm having a hard time with isolates. So I think what we're seeing here is a move to more natural, and I like that.
Well,
I agree.
With the FDA not having regulatory framework for this compound, from the conversations, I sit on APA's board cannabis committee, which is the American Herbal Products Association, sit on HIA, and we talk about this all the time, is how can we allow this amazing plant compound to get out there into the industry, but still have it in a safe and regulatory manner. And the conversation that's been bubbling is that isolate's going to go to pharmaceuticals. And then different concentrations will be allowed, whether it be a over-the-counter or a health food store level. So if, let's say, 10 milligrams or less, maybe a health food store, 10 to 100 may be over-the-counter. Above that concentration may have to go through a prescription, through a doctor, through some. Not saying that's going to happen exactly, but that's part of the conversation, how they're utilized and how they're looked upon in different. Are we treating a specific disease, by using this compound, or are we trying to promote better living or well-being or balance to the body or preventing disease? These different areas and how it's being utilized is going to kind of frame out as this product gets out there more and more. I just think also in delivery systems, someone says, well, what about vaping? Now you're hearing a lot more of hemp flower and smoking the flower. Well, it's not always the compound, it's how the compound affects your system. So I always say people that smoke, especially THC, part of their reaction is not even the plant. It's the inflammation that smoking is causing the body, which then triggers a cascade of inflammatory, hormones and, so forth that affects your body differently. So people have to understand that if you smoke something, fire, flame, inflammation will set up a whole different cascade and you'll feel a different response than if you vape or take an edible. Not to say one's right or wrong, it's just you have to think about not just the product, but the delivery system and how it's affecting your physiology in your body.
Great point there. I know that as we move forward, as you've seen in the expo hall, there are hundreds of different products out there. But number one, we're not being regulated yet. How does a person go about making sure that the product that they may be considering is something that is an honorable product? I know I always say, look for the COA, which is a certificate of authenticity. So I always say that, and then use the research on it. What are your suggestions for finding a good honorable product? You're laughing.
Yeah. So I was actually the medical researcher on a class action lawsuit in South Florida, specifically on this. So essentially what we did was we had one of our associates go around and collect samples, product samples from about 75 different. I don't even know if you want to say distributors, but locations, and then we sent them to a third-party testing site that we had previously verified had good practice standards and was ethical. So of the 75 that we submitted for testing, 27 had 0 cannabinoids. Like we're talking, it was just canola oil, olive oil, whatever. Of the remainder, half were mislabeled, meaning they say they have 1,000, it has 2 milligrams in the whole bottle. And then the rest were with contaminants. I think we only had 3 out of the 75 that actually had, that were properly labeled for what they actually had. Moral of the story. It's really difficult to find a good product. So number one, I definitely agree with demanding a COA. If they cannot produce a COA, I would say thanks, but I'm taking my money elsewhere. That is not a hard thing to produce. So if they can't produce it, that's a giant red flag for me. Second thing is, if they produce a COA, then I'm looking at it. It should not be like 3 lines or 4 lines and a little graph. I mean, a true COA is a detailed document. It's going to tell you the lot number, where it came from, when it was produced. If you're looking at hemp flower, it's going to tell you where the farm was, when it was harvested, when it was packaged. And the other thing that I will do, because this is another thing that we looked at, companies have faked third-party COAs. They have generated these nice-looking documents, and you go to call the number on the bottom, turns out you're actually calling their corporate headquarters. So, if you're at all suspicious, go ahead and call the number.
So I spent close to 20 years in the dietary supplement industry, and I get that question a lot as far as, supplements aren't regulated and this and that, and that's not really true. The dietary supplement industry has enacted DSHEA, which is a guideline for good dietary supplement manufacturing, good GMP. There are organizations like APA and so much holding accountable. Just because it's not FDA approved doesn't mean it's not safe. That being said, this is an industry that we're still in a young stage, and there's going to be always bad actors, and a lot of those happen because you have a lot of private label people who are not caring what you do with this end product, a lot of black market and overnight manufacturers. But the reality is that even when you go back to the hemp, let's start back at first of all, it's all cannabis, right? So we're talking about an arbitrary 0.03% guideline for THC levels, and that's still kind of an arbitrary guideline as to what defines marijuana versus hemp. It's all cannabis. So we look at that, we're already reducing one of the compounds. Maybe we want 0.1%. Maybe that'll make a massive difference to the way CBD works and how these products affect our health. And so we have to think about that. But recent studies shown that even in the same hemp field, in the same genetic pool, you could have a 20% variation in the cannabinoid profile. Right? So then you have, on top of that, so now you're just talking about from the field, and then on top of that, in manufacturing, once you extract it, you could have another 15 to 20% variation as to the percentage or the actual amount of cannabinoids in that product. So even if a manufacturer is doing their best effort, and they're doing it from a single source farm, and they know their supply, and they're putting their own, they're doing their extraction, they're putting the bottle, they think they have consistency, batch to batch, even if their best efforts, they still may have a 15 to 40% variation in that compound, in the spectrum of the compounds in that product. So this is going to take some of the industry, some work to get to that point where we can start to shake out the bad actors. We know what companies are at least consistent. I mean, I did this with probiotics. You can see all the CFUs, colonizing units. They say, mine has 5 billion units, mine has 10 billion units. And then they test and they go, when was that number tested? Was that at manufacture, or is that when you take it and put it in your body? These are different factors. We're still a long way to figure that out, but these are good questions to ask. The one last thing is, from a manufacturing standpoint, there's some basics in order to be compliant. And the first thing I like to ask in manufacturing is, do you have an adverse effects report log? Are you keeping a record? So that means that if you as a patient or a customer go out there and you buy this product and you take it and you say, oh man, that gave me a massive headache. Is that normal? And you call the company and you say, look, I bought your product and I had a massive headache from it. Is that normal? Even if they say, yeah, that's normal and it never bothered you again, they need to keep a record of that call. It's a very simple, basic procedure that I have to say that most manufacturers, most companies out there in the market are not doing. And the reason that's important is because FDA is not there to tell you don't take it. FDA is there supposedly to protect your interests, your health and your safety. And if companies are not reporting what's happening in the industry, not giving us a mass understanding of what is going on, it helps, it kind of really works against us as consumers, manufacturers, as scientists, as health professionals. So there's a couple of these factors that, aren't very commonly spoke about, but I just want to bring out that there's a lot of nuance behind the scene that needs to be still developed in this industry.
So can I ask you a question?
Yeah.
We've been seeing a lot with microbial.
Right.
And the bioavailability of microbial, it seems to be more sustainable or more precise than the others. Do you agree with that, or is that something, how do you feel about the microbial?
So when they test products, they're looking at obviously what's in it. Cannabinoid profiles, terpene profiles, as they get more specific, maybe flavonoid profiles and things of that nature. And then the other tests would be microbials, fungal conditions, and then the other one's going to be pesticides and other adulterants, solvents, etc. And even right now, what they're seeing with the vape crisis, they're trying to put on THC, which is not the issue. It's actually the other ingredients that when put in the THC type products that are causing. It's like saying, okay, I smoked this product and the THC did me wrong, but it also has this pesticide or toxin in it. It was not the toxin's fault, it's the THC fault. So you have to look at it from a whole different perspective, that there's other adjuvants. When I first came to Colorado years ago, when it was just medical only, and they had pain centers, and I walked into one, I wasn't legal, but I was there to go in, and they said, oh, would you like this product? Would you like this product? And most of them had THC and CBD, wonderful, but it had artificial flavorings, artificial food dyes, artificial sweeteners, and so forth. That's not medicine. That's counterproductive to the health and wellness. So it's not just always the ingredient, the CBD or the THC. Look at all the other ingredients in that product, especially edibles and so forth, that if you're ingesting high fructose corn syrup and think that that's not going to affect your inflammatory markers when you're trying to get benefit from CBD, you're missing the boat there, So it's got to look at those cleaner quality products.
Thank you. Jenna, you're manufacturing a product. How much testing, research, and do you guys have a COA? I'm sorry to stop with that.
No, yes, we absolutely have a COA. So we do a full panel COA where we're testing for cannabinoid profiles on top of heavy metals, pesticides, all 9 yards. So yes, it's very important to us. We kind of pride ourselves in that. We had a local news channel do kind of the same thing you guys did in Florida, where they went around and tested multiple products from multiple companies. Ours did not get pulled, but there was only one company out of the 5 that they tested that came back correctly labeled. I am confident that ours is also correctly labeled, but it just goes to show you that COAs are important, but knowing where your testing is coming from is equally as important.
So number one, you have to consider, as a consumer, as a patient and a clinician, you need to definitely look at the COAs and the responsibility of the products being made. Make sure you research the product, but also you need to speak to your physician about what pharmaceuticals you're taking and the combination of the CBD and moving forward for your better health and balance. That's what's really important here. And, I want to go ahead and just wrap this up. We're going to close and then we'll do Q&A. Would you like to have the last few words, Rick?
I mean, honestly, as far as the utility and the potential for utility as far as CBD, and by the way, when I say CBD, I'm not just referring to the singular cannabinoid CBD. I'm really using as a catch-all for CBD and the other minor cannabinoids, really everything but THC. So the utility of CBD is massive. But exactly as Rob said, it is not a panacea, okay? And that's really one of the biggest conversations that I have, not only with patients, but with my referring physicians. They'll send me folks that have zero cartilage in their hips, and they say, well, my patient doesn't want a hip replacement. I go, I'm not going to fix that.
Here.
Like, exactly. I mean, you have to... It really comes down to the same principles that I would advise my patients before surgery on the neuro side. You have to pick the right therapy for the right patient. Okay, so if this meaning CBD or cannabinoid therapy is something that could potentially benefit the patient, and it's safe for that patient, then I think it's incumbent to at least try. But if it's something that doesn't, that doesn't fit that profile, I really don't think that it should be there. So it's got to work.
Thank you so much. And then Roger, how about you? Your last
Well,
word?
trackability and accountability. We said a lot there. We need to be able to go to those barcodes and go back to the parent plants. We've got to go back and look at how they're extracted. We got to go back and look how they're treated by the lab. We got to go back and look at how they're manufactured and how the manufacturer does it and the doses they do in there. That accountability is huge, because if we don't set that standard, you know, what Rob says, what all these guys says, we've got to put a product out there that tells you how we got there. And if we do that, I think we can start building some confidence in the marketplace, but we've got to put a product out there that makes a difference.
Thank you. And Jenna, your last takeaway for our wonderful audience.
I would say continue the education. Keep striving to know as much as possible. And you know, the saying, the more you learn, the less you know. That is completely true in this industry. I've been to this expo multiple times, and every single time I'm here, I learn something new. I used to sit in the audience at every single one, and now I'm on a panel. So it's incredible what you learn from doctors and physicians and attorneys at these expos. And just keep thriving to be the best and produce the best that you possibly can.
Thank you, Jenna. And Dr. Rob.
Yeah, there's just a lot of great information. Keep educating yourselves. I said, even when I was talking about the 20%, even the labs today, their own testing can, from one lab to the next, can be using different protocols. So there's going to be a long journey of standardization, regulatory framework, but you guys are in it early. This is still, you know, early stage of an industry, even though it's been popularized. And to keep learning and know that, again, start low, get good quality products, give feedback, and keep learning. And it's just going to keep on being a major part of our healthcare model in the next many years to come.
Thank you so much. I know some of you may have questions. Don't be shy, because these amazing panelists are here for you. If you have any questions, go ahead. Yes.
Just based on the title of the panel, as you kind of correctly, what conditions are you having seeing the most success return rates with your patients who start to see
Now we're talking about just CBD specifically, or
like you said, like, you know, with the power of when you start administering the full spectrum product that you really love, like what do you see the most return on?
so taking THC out of the equation. Honestly, the highest yield that I would say that I would say that late stage Parkinson's, especially those that have the non-motor symptoms, and also Alzheimer's, especially when you're talking about sundowning. Those really come to mind. MS. So I mean, obviously, neuro background. I deal with a lot of neuro patients, but GI works hugely with it. And then you have just your general MSK, so your musculoskeletal, type of maladies as well.
Yes.
Typically, with inflammatory plays, I see can take a little time to do stories and whatnot. Like, so I guess in part one, you guys see that as well, or you guys see that has anybody seen actual data that shows like after ultimately reduces the CR top inflammatory marker?
I think one of the challenges, as I said earlier, was that there's so many factors involved. So I'm a big gut health guy, as you were saying, and if you really target the digestive system and getting inflammation down through that pathway first, which is where CB2 receptors and CBD in general works very well, and a lot of the cannabinoid acids are really good for. So even when they're in the raw form, that's really where I'm passionate about seeing a lot of effect. You can reduce your inflammation, and then that allows, again, if the body has a pause, right? If you have that moment, that's why it takes a few weeks, but if you give the body that pause to allow it to heal itself or to find its own balance, that's where you see the long-term benefits. I've seen some value, obviously, in acute issues with pain and inflammation, but it's really when you start to address the underlying imbalances, and that could even come from a food allergy, that's triggering the cascade of cytokine cascades. That's something that we're looking to still understand better every day. And a lot of these are being still done in mouse studies that doesn't really translate to the human diet, the human lifestyle, and the human stress factors. And so when I looked at digestive health, it was always adrenal or life stress would stimulate adrenal function, would elevate cortisol levels, which would then thin the lining of the digestive tract, reduce secretory IgA, reduce the mucus protection of the digestive tract, open up leaky gut, which would now allow for autoimmune and inflammatory results. So this is not one-to-one. It's how can we look at this from a holistic standpoint and treat these issues. And that's what, as a patient standpoint, I'm seeing a lot of these people, unless they come in with a dramatic medical issue, they're just looking for ways to get better quality of life and have a reduction of their symptoms and a reduction of their pain and to be a little bit more mobile, and that motivates them to try other things and to do other things to support their health.
Overall, we're looking for homeostasis here, the balance of the body. And when we look at pharmaceuticals, they usually work on masking the symptoms, whereas natural plant-based medicine looks at taking care of the cause. Generally speaking. We're going to take one more question and then
One thing. So, to your question, at a cellular level, you'll see almost instantaneous changes with activity of NF-kappa B, TNF alpha, IL-2, IL-1, IL-6. But you're going to see especially for inflammatory processes, you're going to see a faster clinical change if you incorporate THC, because again, it's synergistic, whole plant therapy. But in general, especially if you're looking at UC and Crohn's, typically clinical intervals for colonoscopies, study protocols are usually looking at 6 and 12 week intervals.
one more question.
My question is regarding patients that are on high blood pressure medication nationwide as an online retailer. We're seeing questions and comments specifically about their medication with blood pressure,
Right.
What should be addressed in this argument?
Okay. So for me, it's make sure you work with your healthcare professional, your primary care. That's the first step I always suggest. However, as a naturopath, there are numerous ways to A, understand why you have high blood pressure, and B, how you can improve your naturally. So if I have a patient, and I'm not suggesting this for anyone with medications, or this is just a general statement, there are tools and tricks, like even an ounce or two of celery juice will actually, taken on a daily basis, will help lower your blood pressure. Magnesium, certain magnesium supplements will lower the blood pressure. What is causing that underlying high blood pressure is where I always look for, and many times that's elevated chronic cortisol, and that's chronic stress response hormone. And that fact is that when you have elevated cortisol, especially chronically, it is vasoconstricting, which causes an elevated blood pressure. So while you may want to lower the numbers and help to relax the muscles and the vascular system with magnesium and other things, you want to nutrify and balance that cortisol response. And there's a lot of great herbs and plants that help to do that. A lot of minerals taking that you're deficient in. So again, it's not saying, okay, high blood pressure is, people don't wake up and say, oh, I have high blood pressure. Usually it's a cascade of dietary and lifestyle imbalances over much time. And many times you can address that by the underlying causation, which is typically what everyone has is elevated cortisol and stress hormone. So if you can start to address that underlying issue, again, that's not the diagnosing treatment of an individual in front of me that I have lab work and blood work and so forth, but as a general statement, that's how I look at blood pressure. But if you do it, if you start to use CBD, I would talk to your healthcare professional and say, look, I'd like to get off some of these medications. I don't want to do it haphazardly or go cold turkey. That's not advised. Even with NSAIDs, not advised. It's saying, how can I work with you? Are you willing to work with me as I take control and become an advocate for my own health, and I want to incorporate more natural things? If that doctor doesn't want to do that, find another one.
Yes.
Thank you. I want to hopefully be giving you enough information and give you a little bit more insight into this. Did we provide you with that information?